Sex education. Sex education is the activity of offering knowledge about sex and sexuality and make healthy decisions regarding this. It should cover topics about relationships, sexual identity, body language, decision making, contraceptive methods, and sexually transmitted diseases. The study which was conducted in our department, in that same study which was conducted for menstruation, it included the topics, and in this we asked the school going children of age group of 10 to 14 years, both boys and girls, as how much they are aware of changes during puberty, the feeling of attraction, which sometimes has a part of guilt in that children if he or she thinks that this is not normal. For the changes they are having in their body, this is two very important factor: having night falls, feeling attracted towards opposite gender, be it a girl or a boy, development of secondary sexual characteristics, that is hoarseness of voice and facial and pubic hair growth in boys, and for the girls the enlargement of breast and pubic hair growth. The children were asked as thus what was their source of knowledge about sexual related topics, that is whether the parents were the information source or commercials or friends. Such education helps the adolescent and pre-adolescent age group know their body biologically in a more better way. Firstly, it helps to increase the abstinence until they get older regarding sexual activity, because there are various side effects of having sex at very early age. It also helps to build their boundaries against sexual activities. Thirdly, it helps to differentiate the children for the kind of touches which they can experience. That is whether it is a good or it is a bad touch. And especially this topic that about the touch, it should be told at a very smaller age group also, that is about 3 to 4 years, to help prevent the topic of child abuse, or if it is happening, at least those small toddlers should be able to tell their parents about it. If also we could teach these school going children in which were part of the study, if any of them have their younger siblings of this age group, they too can teach their younger siblings about this, because we know that the siblings are more close to each other compared to their parents, and this would be more helpful for them. Teaching this. Fourthly, understanding the importance of consent regarding sexual activities. Nowadays, majority of info for school-going children also includes pornographic film to an extent, which sometimes forms their sole basis of information. This needs to be tackled as early as possible, seeing the reach of internet, because if those children are having their information based on a pornographic film, it might be detrimental for them, that the knowledge which is being imparted to them is not that adequate, or might be just opposite to what happens in reality. Also, the topic of masturbation and the taboo around it, because although excess of everything is bad, but still we should know about what is masturbation and the feeling of sexual pleasure. Teaching parents is also important, as they should also know the impact, should be able to impart the knowledge to the children, because from their perspective it is more important that they should tell first, and not the school in which there is a whole group of people, and sometimes people are very shy to present themselves regarding these topics. Also, the topic of sexual transmitted diseases and the methods of contraception are very important. Although this is being taught in the textbook also, but still the more practical part of it is not very much known to children, and also teachers as well as parents try to avoid these topics. We know that in India, the problem of psychological erectile dysfunction is more common than the physiological type. The reason being the lack of education in this generation or the previous generation, which is having an impact whenever someone goes to have sex for the first time, and he or she is not aware as how their body reacts and what changes they can have during this period. They might get sometimes very irritated about it or very anxious about it, and this can lead to this problem. So we should be able to teach this about this to them.